Welcome to Mothering from Within, the podcast where we dive into the heart of parenting during those magical yet challenging first few years. I'm Kaili, a mama of two, a pediatric occupational therapist, and your guide on this beautiful journey of motherhood. Every week, we explore the wonders and hurdles of motherhood with curiosity, we gain clarity around our babies, and find the courage to trust our instincts. If you are a mama who wants to do motherhood your way, confidently, courageously, authentically, then you are in the right place. So grab a cup of tea, tuck those little ones in for a nap, or bring them along for the ride. It's time to get curious, gain clarity, and unleash your courage to do motherhood your way. A gentle disclaimer, please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or healthcare provider. Hey mamas, welcome back to another episode of the Mothering from Within podcast. If you've been following along, last week I had a special guest expert, occupational therapist Kelsey Baker of Be Well Tots. We chatted about how tongue ties are related to torticollis and how they can really impact your baby's development in so many ways. This week, I'm going to be diving even deeper into the world of baby well-being and talking about something super important, body tension. Body tension in babies is one of those underlying root cause issues that doesn't always get the attention it deserves. But it plays a huge role in how babies move, sleep, and yes, even feed. So if you've noticed that your baby is struggling with rolling over, sitting up, sleeping soundly, or even having trouble feeding, then this episode is for you. And of course, I've got a free resource to help you out, my Baby Body Bliss Guide. It's a simple tool you can use at home to assess whether body tension might be impacting your baby. You can find the link to grab a copy in the show notes below this episode. First, let's talk about what body tension actually is. Body tension happens when your baby's muscles and fascia, that's the thin layer of connective tissue that wraps around muscles, nerves, bones, and organs, etc., when that becomes overly tight, making it harder for your baby to move freely and comfortably. This tightness can come from a variety of sources. How your baby was positioned in the womb, maybe from birth trauma or interventions, or muscle tightness that hasn't resolved naturally as your baby grows. When a baby has tightness in their neck, back, shoulders, or even their hips, this restricts their movement and makes hitting important milestones like rolling over, crawling, or even sitting up more difficult than it should be. Now, I want to talk about feeding because body tension can seriously impact how your baby eats. In episode 22, I talked all about tongue ties and how they can affect your baby's latch. But body tension plays a big role here too. When a baby has tightness in their neck, shoulders, or jaw, it can prevent them from latching onto the breast or bottle effectively. This tightness can lead to a shallow latch, causing your baby to work harder during feeding, and they may end up gulping more air or popping on and off the breast or bottle. If your baby has tightness in their tongue, lips, or cheeks, this can also impact the seal that they have around the breast or bottle nipple and how effective they are at suck, swallow, and breathe patterning, and also extracting the milk efficiently. You might also hear those clicking or gulping sounds as they try to feed, which is a sign that they aren't getting a good seal around that nipple. And what happens when babies swallow too much air? They can get gassy and uncomfortable, leading to reflux-like symptoms. This creates a cycle. Your baby is trying to feed, but is taking in air, which leads to gas, reflux, and discomfort, which leads to fussiness. And then they may not get enough milk during each feed. This can make feedings longer and more frustrating for both you and leave your baby hungry and therefore fussier as well. Now let's zoom out and talk about development as a whole. Body tension isn't just limited to feeding. Tight muscles and fascia can limit your baby's ability to reach important developmental milestones. For example, if your baby has tight fascia in their neck, they may have trouble turning their head from side to side. This could affect their tummy time, which is super important for developing the muscles that they need for rolling over and sitting up and eventually crawling and pulling to stand and walking. Tightness in the hips or lower back can also make crawling and sitting up more difficult. You might notice your baby favors one side. Maybe they arch their back more during tummy time or during feeds, or they seem stiff and uncomfortable when you try to move their arms or legs, for example, when you're getting them dressed. These are all signs that body tension might be playing a role in how your baby moves and develops. Finally, let's dive into how body tension can affect sleep. Babies with unresolved body tension often have a harder time settling down and staying asleep. It's like us as adults. When we've got a stiff neck or sore muscles, it's hard to relax and get comfortable, right? Well, babies are no different. When there's tightness in your baby's body, they might struggle to get into a comfortable position or to into a deep sleep. They might wake frequently at night or take short, restless naps because they're just uncomfortable. And as I mentioned earlier, when feeding is impacted by body tension, your baby may not get a full feed, which means they'll wake more often because they're hungry. So if your baby is waking frequently and you've ruled out hunger, environment, or overstimulation, body tension might be something to consider. So, what should you be looking for when it comes to body tension in your baby? Here are some key signs that might indicate that your little one is dealing with body tightness or tension. Difficulty turning their head from side to side or a preference for one side. Stiff or tight arms and legs that don't relax easily, arching their back frequently during feeds, tummy time, or when being held, fussiness or discomfort when placed on their back or on their tummy, difficulty sitting up without slumping or leaning to one side, trouble latching or making clicking and gulping sounds during feeds. If any of these sound familiar, body tension could be playing a role in your baby's feeding, development, and sleep. The good news is there are some things you can do at home to help release your baby's body tension. Here are a few simple strategies. Gentle stretching. Slow, gentle stretches can help release fascia around your baby's shoulders, hips, and limbs. It can also help to move slowly because fascia responds best to gentle pressure over time. You can also hold your baby upright. Holding your baby upright, such as in a carrier, can help stretch the fascia around their neck, shoulders, and back. It also promotes digestion after feeds because of that upright position. Tummy time helps stretch and strengthen your baby's neck, their chest, and abdominal muscles. I want you to encourage your baby to move their head and arms while on their tummy using toys or your own face as a motivator. Next, we have infant massage. Using soft circular motions, you can massage areas like the neck, the shoulders, along the spine, the legs to gently release fascial tightness. We also really want to encourage your baby to move, to roll, reach, and stretch by playing on the floor with them. These movements help release fascial restrictions and improve mobility. While there's a lot you can do at home, sometimes professional bodywork can make a huge difference. Modalities like craniosacral therapy, pediatric chiropractic care, and osteopathy are all designed to help release fascial restrictions and support better movement in babies, along with nervous system regulation. Craniosacral therapy is especially helpful for babies who have experienced birth trauma or difficult labors, and it can release tension in the fascia around the skull, the spine, and the pelvis. These therapies, along with others, can really help your baby to reach their developmental milestones with less discomfort and more ease. If you think body tension might be impacting your baby's feeding, development, or sleep, I've created a special resource just for you. The Baby Body Bliss Guide is a free guide that will help you assess your baby's body tension at home and includes simple exercises to help release that tension. You can download it using the link in the show notes below. Thanks so much for tuning in today. Next week, we have a special guest expert who will be joining us to dive deeper into how craniosacral therapy can support your baby's development and help with body tension overall. You won't want to miss it. Until next time, take care of yourself and your little ones. Thanks for joining us today on Mothering from Within. If you're ready to take things a step further and get more hands-on support from me in all areas of baby in those first 2 years, the Mothering from Within Collective is waiting with open arms. This program offers an intimate, high-touch coaching journey designed to empower you with the confidence and clarity to embrace motherhood on your terms, free from guilt. Get curious about your parenting values, gain clarity on your baby's sleep, development, and more. With comprehensive courses, one-to-one support, group Q&As, and a nurturing community. This is your invitation to join a community of mamas doing it all their own way, supported, seen, and held. Visit the link in the show notes to learn more about the collective and how we can walk this beautiful path together. Until next time, stay curious, embrace clarity, and let your courage shine.